Volleyball injuries are common and are often due to repeated jumping, hitting, and blocking. Today we are being joined by Dr. Joshua Gatz, a pediatric sports medicine physician at the Detroit Medical Center, to talk about common volleyball injuries, treatment, and prevention. Dr. Gatz specializes in advanced non-operative procedures and served as a team doctor for DCFC, Detroit's professional soccer team, and the Detroit Red Wings. He is also an athlete himself and will be competing in the Ironman World Championships on October 26th. Welcome to the podcast, Dr. Gatz, and congratulations on making it to the Ironman.
Thank you, guys. Thank you so much for having me. I appreciate it. It's nice to meet everybody.
Yeah, nice to meet you too. We're looking forward to hear the updates from that Ironman competition. But
yeah, hopefully good updates.
yeah, definitely. Well, we'll get started here. So our first question of the day is, given the physical demands of volleyball, what are some of the most common injuries you see?
Yeah, so I kind of like to parse them into two categories, whether an acute or an overuse injury. So acute injuries, kind of those are, happening on the field really quick. The most common thing that we see with volleyball players is probably ankle sprains, or you kind of like invert your foot. We also see finger, thumb dislocations, shoulder dislocations, the always kind of concerning ACL or ligament tear in the knee, those injuries. Falling out onto an outstretched arm, you can sometimes those can be somewhat traumatic and lead to fractures in the wrist or in the elbow. And then, though rare, concussions can happen, whether a ball comes through or another collision with the net or a player. And those should always be taken very seriously as well. The overuse injury is probably a little bit more common. The most frequent thing that we see is jumper's knee or patellar tendonitis. That's kind of an overuse injury. You'll feel that kind of in the front of your knee. That's irritation in that the tendon that attaches the kneecap down to the shin. Almost 50% of elite volleyball players will actually experience that at some point during their season. We also can see shin splints, problems with the Achilles tendon, kind of in the back of the heel. Setters and hitters can get overhead throwing injuries, such as younger athletes can get what we call little league shoulder, and then older players can get rotator cuff tendonitis. And then always, lower back strains from twisting, or even sometimes stress reactions in the back as well. And all these things, these are things we see very, very frequently, both at DMC Sports Medicine and Children's Hospital of Michigan Orthopedics. So things that we see very frequently, and never, would want an athlete to feel singled out that this is, an abnormal thing. So we're kind of prepared for any of these.
Yeah, so after hearing that list, what is the best way to warm up before practice or a game to help prevent injuries?
Yeah, so, there used to be kind of a myth probably 15, 20 years ago that the best thing was just static stretching, bending down, grabbing your toes, holding that for 30 seconds. I remember probably when I was in gym class in 5th grade, that was what we would always do before a practice. And new research is really showing that we want to be more active with our warm-up. So I always kind of recommend doing a light 5 to 10 minute jog, get your muscles warmed up, and then doing more dynamic stretches where you're kind of, swinging your arms, swinging the legs, kind of more active movements. And then the static stretching, where again, you're kind of reaching, bending, holding those positions for 30, 45 seconds. That's more to be done at the end of our exercises. So you always want to do a good 10 to 15 minute warm up with these dynamic exercises, and then the static stretching after a cool down for another probably 10 to 15 minutes. And that's really the best way to kind of avoid a lot of these overuse injuries.
It's good to know. I feel like I've been doing it backwards. But when an athlete is injured, when an athlete is injured, surgery is not always the first or only treatment choice. So what are some non-surgical treatments the DMC offers to treat sports injuries?
So I always kind of like to say that the first step in management of any injury is a proper diagnosis. And, at DMC, at Children's Ortho, we always, that's kind of our initial goal. And that entails a lengthy discussion, hearing about, when everything started, taking a good history about, what specifically is bothering you, doing a very thorough physical exam, leaving no stone unturned. A lot of times that might entail getting x-rays in our clinics, and if necessary, some advanced imaging. We frequently use MRIs. We're also trained in using ultrasound, which is where they use kind of like a probe with some gel, and that can help us look at joints and further kind of help us with our diagnosis. And then once we establish that, we have individualized treatment plan for each patient. If rehabilitation is necessary, we work very closely with the physical therapist in the area, exchanging notes, kind of talking about what we're noticing and what they're noticing to kind of get our athletes back as soon as possible. We also will create home exercise programs. I have a tool that I'll use that allows me to email kind of specific exercises based on what I'm seeing on my exam that a patient can do at home to kind of help further along. We work with orthotists for certain bracing, but for example, the patellar tendonitis jumper's knee that I mentioned, a lot of times we might prescribe a patellar tendon strap to help offload some of the stress on that knee joint. If for any fracture, broken bone, we're all trained in casting and have wonderful, amazing casting techs in our clinics to help with that. And then me personally, as well as the other non-operative sports physicians, we're trained especially in ultrasound. As mentioned, we use it for our diagnostic procedures, as well as other interventions such as injections, muscle releases, and such like that. And then finally, me and some of my other colleagues as well are trained in osteopathic manipulation, which is more of a hands-on approach to musculoskeletal disease. Often at times we'll incorporate manipulations, using our hands to kind of release muscle tension, stuff like that. So definitely a wide array of kind of modalities that we can use to really individualize our treatment plans.
Wow, the advancement for medical treatment is crazy. That is unbelievable.
I have to say, I mean, coming into sports medicine, I mean, this is the time to be in the field. Like if you look 15, 20 years back, I mean, the things that we have, particularly with ultrasound, I mean, the advancements that we've made, the utility that we're finding, even, at our national meeting every year, we'll have lengthy discussions about different ways that we can use it. We're finding that we can sometimes diagnose fractures with it, tendinopathies. So it's definitely an awesome tool to kind of be able to incorporate now.
Yeah, and you can relate to a lot of people listening. As an athlete yourself, you're getting ready for the Ironman as we speak. What training advice can you give athletes to avoid overuse, injuries, or burnout?
So I take this very personally. I myself have been a culprit of overtraining, so I definitely realize how difficult it is to really kind of take a step back and kind of realize that maybe you need a day off. And I understand how difficult that can be, how frustrating that can be. But really, there's two elements of overuse and burnout. There's the mental aspect and then the physical aspect. And overtraining can lead to both of these, mental burnout as well as these kind of overuse injuries that we talked about. Some signs and symptoms that kind of can be some warning flags, mood swings, fatigue, elevated heart rate. I have my watch that I use for my races. It'll kind of, and I know a lot of the Apple watches, the Fitbits, those will kind of track heart rates. You'll notice in the morning your heart rate is higher. Poor sleep, anxiety, trouble focusing in school. These are all kind of signs that really your body's kind of telling you, man, we gotta slow down a little bit. And it's important to kind of listen to that, realize whether you need a rest day. I usually like to take at least one day off a week from my training, or even active recovery, just going for like a 20-30 minute walk or an easy jog just around the block. But really taking kind of a step back from your primary sport and allowing your body time to recover. And then also, taking time off throughout the year, playing the same sport 12 months out of the year, you need time to kind of, again, take a step back, give your body a chance to recover. There's new research coming out talking about how the risks of sports specialization, where you really at a young age start to focus on one sport, and showing the benefits of really kind of diversifying, that'll kind of train other muscle groups to help prevent some of these other injuries. So I always recommend, for example, if you look at like LeBron James, right? He's one of the greatest basketball players of all time, but he was also a 5-star tight end recruit in high school and probably could have gone and played football anywhere. And look where he is now. And, he's been a little injured the last couple of years, but for the first 15 years, he was completely trying to kind of diversify, engage in other sports is definitely important. And then one last thing, I think, especially in high school, I feel like we kind of falls to the wayside. But our nutrition, our sleep, and our hydration are unbelievably important. Making sure we're getting the calories we need to kind of both practice and compete at the top level that we're at, meeting our goals, and then sleeping for an athlete 9 to 10 hours, which is definitely difficult with the schedule in high school. I know when I was swimming in high school, morning practice, afternoon practice, I wasn't always meeting that, but trying our best to kind of, again, give our body a chance to recover.
Yeah, definitely easier said than done, but it can be done. We know that. And finally, last question here: when should someone see a sports medicine physician?
Yeah, so definitely not every injury requires evaluation by a sports medicine doctor. For sure, anything that's bothering you, anything that's concerning, particularly in the middle of your season, you don't want something to kind of fall by the wayside. We're always happy to kind of evaluate you again, figure out a personalized treatment plan. But things that really kind of raise red flags, reasons to kind of seek out treatment, really anything that's starting to kind of inhibit those daily activities that you do. You're having difficulty walking, jogging, running, things that kind of nagging pains throughout practice that might, especially if things are starting to get worse, persistent progressive swelling, really kind of those things are kind of about where I'd recommend to start considering to go see a physician. And I realize no one wants to go spend their afternoon sitting in the doctor's office and getting x-rays, but we will make it as painless as possible, and definitely, again, try to get to the root of the problem and get you back on the field as soon as possible. And, the quicker a problem's identified, the quicker we can kind of figure out how best to attack that so that we can have a successful rest of the season.
Yeah, we got to remember we are in good hands when we see our sports medicine physicians. That's for sure.
Appreciate that. Yep.
Yeah. Well, thank you, Dr. Gatz, so much for joining us, and good luck in the Ironman coming up here real soon on October 26th. We're rooting for you over here at State Champs.
Thank you. I'll need it.
Oh, yeah. No, you got it. You got it in the bag.
Yeah.
All right. Thank you so much. And don't forget, the DMC is the official healthcare provider for the Detroit Red Wings. If you have a sport injury, go where the pros go, the orthopedic and sports medicine team at the Detroit Medical Center. To learn more, visit dmc.org/sports or call 1-888-300-DOCS, DOCS.